Happy Friday, Illinois Chiropractic Society. This is Rob French, Director of Government Relations, and Mark is actually out of the office, so I'm going to be bringing you your video today, and I hope that you and I figure this whole process out together. Essentially, I know what Mark likes to try and tackle are questions that we get asked a lot, so here's something that comes up on a fairly regular basis. Hey ICS, I have a recent graduate. They're great, and we want to bring them onto the practice and really get them integrated. How do we go about letting them adjust and see their own patients and all that stuff? The answer to that question is you don't. In Illinois, there's no such thing as almost licensed. You either have it or you don't. So what you need to do is realize that what you're working with is a highly trained CA. Standard delegation rules will apply, so just make sure that someone's on site who is licensed to perform the work, that the recent graduate is receiving detailed instruction and is making no judgment calls on their own. But we've covered delegation in many articles and things on our website, so you can feel free to look those up. What it's going to boil down to is no adjustments and no diagnosis, because those are two things that are specifically physician only. One other thing that we should mention is the actually term doctor gets tricky. Yes, like we said, we know that they work very, very hard and they have their doctorate. And we know that if you are in a college setting and your professor has their doctorate in English, it's Dr. Smith. However, in a healthcare setting, there is a implied belief from the patient's point of view that anyone that's going to be introduced to them as a doctor is in fact going to be a physician and is going to have a current license. So it's important that whenever you're introducing this recent graduate to patients or to whomever, it doesn't say doctor on their name tag, and you're not introducing them as, oh, he's a doctor, he's almost licensed. Don't use any of those things. It's just it's Jim, and he's a highly trained individual, and he's going to sit here and he's going to go through your modalities with you, and if you have any questions, Jim will refer it to the physician. The second that Jim checks the IDFPR website and sees that his license has clicked and that he has a license number, you can flip your switch. You can give him the doctor name tag, he can start seeing his own patients, all that. But until that moment happens, he's not a licensed physician, and you need to make sure that you're very, very cautious about that, because one thing that neither the owner or the recent graduate wants to do is actually start off this graduate's career with a practicing medicine without a license on their discipline. So I hope that helps. If you have any questions, we actually have an article on the topic. If you go to our website and search for graduate employees, it'll come up. And so you can find more information there. But until then, if you have anything, feel free to always contact us at the ICS. This is Rob French, out.